So You Want to Change the World, a podcast sponsored by the UNLV School of Public Health. This podcast is designed to highlight some of the outstanding work of our faculty, staff, and students, and how public health changes our world, our community, and improves our quality of life. Well, welcome today. I'm thrilled to introduce our next guest on the School of Public Health podcast, which is Jodi Tyson. Jodi is an alum of our school. She graduated back in 2006, also was the Alumna of the Year back in 2016, and I think was part of our inaugural class of students.
I was part of the first group between 2004 and 2006, and honored to have tested out the program for all our future students.
Yeah, that's awesome. I remember our early conversations about our program starting, and it was pretty exciting. Right now, she currently serves as the Vice President of Strategic Initiatives at 3 Square Food Bank, and that organization has certainly had a huge impact on our community, and I know you've played a major role in a lot of those things. So I would love to hear about a few of the initiatives that you've been a part of, that you're excited about, and how those impact our community and how they're related to public health.
Well, 3 Square Food Bank actually got started in 2008, and I came on board in 2009. So I really was kind of part of the lifting up of the organization over time. Many communities have had food banks for a long time, but ours has been relatively new. And when I came in 2009, I really wanted to bring that sense of transformation to the food bank's philosophy to be more a part of the public health institution of Southern Nevada. Mm-hmm. And some of the great projects that we've been able to work on over the years include a lot of programs that help targeted populations of people that aren't generally as well served by the traditional model of a food bank, mm-hmm. and also helping to push policy forward that really makes sure that we are doing everything that we can to impact as many people in our community who struggle with poverty and food insecurity and timeframes when they're out of work.
Well, it's awesome. It's funny you should say that, because I always joke with your CEO, Brian Burton, that they're not a food bank.
Right.
They're a public health organization, because you do so much more than simply provide food to our community yes. partners who distribute it. But one thing I do know about you, Jodi, I've known you for a long time, is that you have an unwavering passion for the disenfranchised, for the underdog, for the marginalized, for those who don't have a voice. And I know that is where your heart has lied since, right. has lied since day one. So tell us about that. Where did that come from? Where did this heart for others come from? It's one of the great things I love about all people in public health. Yes,
we do have a common thread of equity, diversity, and inclusion, and making sure that everyone gets to live happy, healthy lives. And mm-hmm. That really brings us in and makes us part of a community that's bigger than ourselves, and gives us so much to talk about whenever we get mm-hmm. together, right? My mother was a nurse, and so she was just really a caregiver person who mm-hmm. had the best bedside manner, and really just such an asset to our small town that we lived in. There were very few doctors, and she was kind of the nurse that was the nurse to everybody in our town. And I think that I got a lot of that sense of caregiving and responsibility to others from her, but I couldn't handle blood at all. Still to this day, I run away from every needle that ever approaches me. And so I was looking for ways to make sure that we could take care of others in our community, but through maybe a more universal method of public health and helping people to live their best lives. And I really feel like I found that through policy. And so I got my bachelor's degree in political science, and really set out to change the world mm-hmm. all at one time. And I found an opportunity to really think about how you implement policy at the local level. And so my first jobs after graduating the first time from college was to help implement the Violence Against Women Act in mm-hmm. Southern Nevada in the early 1990s, and kind of peeling apart this major piece of legislation, but really what could we do to make sure that women and children knew that that it was okay to come forward, that they could get help and services, that we could reduce stigma. And so all of those things that were coming together just felt so natural to me, and just what could we do to make sure that people who had lived through some of the worst experiences in their lives had an opportunity to heal, and to even relay sometimes some of the experiences that they've had, to help make sure that other people knew that it was okay to not be okay okay in that space
Right.
and to come forward and get help. And so as I was going through these policies and really working for close to 10 years on the Violence Against Women Act, I came in touch with Mary Guinan, who was the founding dean of the School of Public Health at UNLV. And I had said to her one time, I think I need to go back and get my master's in policy. And she said, no. You need to come and get your master's degree in public health at UNLV. And I was like, oh, well, actually, that would be great. And if there was a program in public health in Nevada, and she said, we're building one.
We're working on it.
We're working on it. And so in 2004, then I had the opportunity to be part of that originating class. And so that's really where I feel like I kind of cut my teeth with my family and our experiences, and then also really helping to implement policy on a local level.
Yeah. There's a phrase in there that kind of stuck with me, right? It just felt natural.
Yeah.
Right. And I think we hear that a lot. Like if
Right.
you're passionate about something and then you go and pursue the degrees and you get the education and the skills to make a difference, it's literally where the name of this podcast came from. Because everybody comes in and they're like, well, I want to do this. I'm passionate about it. I want to go change the world. And we were joking about the title when we created it, but almost everyone in public health I talk to, that's where it came from. There's some personal experience, some individual, your mother, Mary Guinan, whoever it is, that kind of kicked you down that path that said, you're good at this, you're passionate about this, and that's where things change. And so the other thing that I've heard people tell me many times is like, well, I don't want to go into public health because we don't do policy, right? I'm like, what? And, I kind of cringe when I hear that because it's a huge part of how things change is implementing those policies and making sure that we can change the things that are broken in the system that disallow people to use or access the resources. And and you, I know, spend a lot of time doing that. So
some of the things that I actually was, when I was asked to come work at the food bank, is because I had the experience of not only implementing that policy, but also being able to report back and say, but if we also made this tweak, so in essence, lobbying for changes in future pieces of legislation. And so to be an amazing public health person, I think you need that balance of like, what's the individual? How can I help the individual in front of me? But also, how can we look to policy to making the most amount of impact for the most amount of people?
I know you're modest, but I'm going to try and tease it out of you, right? And I want to get into the weeds a little more about some of these programs, because I know you've launched and been responsible for managing or starting some really significant programs surrounding seniors or children.
Yeah.
So how about taking me a little deeper dive on one of those that you're really proud of, and tell us how that's impacting so many people in the community daily, weekly, monthly, yearly, because I know they're there. I know what they are. I'm going to keep pestering you until I get them out, right?
The traditional model of a food bank is to bring in food and funds, and then to be able to disperse that food out to many, many agencies across the community. And then those agencies kind of, in essence, wait for people in need to come to their locations and say, I'm struggling to have enough food. Can I have some of yours? And so that kind of giving nature, but it really relies upon clients to be able to come to a food pantry. And so the role in our food bank, the role of us as being part of public health is who is not adequately served through that traditional means of a food bank. And so we have developed programs that really look at the priority populations of people that are not well served by the traditional means of a food bank. And so you can look at that as basically the ends of the spectrum, right? For children, families who have children, they're one or maybe two working parents in a household, and then there are children. And so when you have more mouths to feed, but you can't send your kids out to work and bring in income, it does make it so that more families will struggle with food insecurity during that phase of their lives. Daycare is very expensive. Even to send your kids to school and have enough supplies or lunch money or things like that is a burden for some families. And so during the times when their kids are small, they are more likely to experience food insecurity than they are when their kids are older and gone, or even a little bit later in their lives. And so we really work to make sure that kids have food, whether that's children who experience bouts of homelessness and making sure that they have groceries to cover them over the weekend when they don't have access to school breakfast and lunch, or helping to make sure that they have that supper meal. So they get their breakfast and lunch at school, but perhaps they also need that well-balanced, healthy supper meal so that then they can go home and know that their nutritional needs for the day have been covered. And then on the other extreme, we have seniors. So as seniors get older and we live longer lives, seniors tend to struggle more with chronic disease. They tend to struggle more with isolation and mental health issues. And here in Nevada, we still have, I think, among the highest rates of suicide among older populations of people. And so that's a big need for us to be thinking about too. And then we also have days where seniors don't feel up to going out, right? So their health deteriorates over time. And then also transportation challenges. So I was talking to one gentleman not very long ago who was 95 years old and still had his driver's license and was very proud of the fact that he still had his driver's license. Right. But he was saying to me that his son was really hoping he would give up that driver's license. I'm sure because he doesn't feel like he's the very best driver, right. But he lives by himself in Nevada and his support system is somewhere else. And so that ability to have your driver's license can mean the difference between being food insecure and being food secure. So when we think about transportation, right. We think about health, we think about all these things, all up and down that age spectrum. So at the food bank, we think about the food and programs, grocery programs, meal programs that we can initiate through the food bank. But we also think about the kinds of programs and policies that we can put into place that help make sure that people get food outside of what we can do at the food bank. So we spend some time doing a program like Breakfast After the Bell. So we notice that very low income schools that have the ability for universal breakfast, so the federal government says the poverty rate among students at your school is high enough that you should be able to make breakfast available to kids before the bell. Well, we noticed that in those schools, the vast majority of kids who would be participating in that program are bused into the school. So you might only have 5 or 10 minutes to have breakfast before you go into your classroom. So we really worked to make some changes so that we had breakfast after the bell available to kids, so that kids actually had the most ample opportunity to have the most important meal of the day, so that they were ready to start school and start learning with a full belly. And we talked to a lot of teachers in advance of that who said that they stored granola bars under their desk and other things that they were funding themselves to make sure that when kids said that they were hungry, that they could feed them. So why not use policy as a way to, I mean, the policy was already there that those kids should be fed, but just thinking about tweaking that policy so that the most amount of good could happen for the most amount of students is a way that we could use policy to help make sure that people were getting fed, even if it never came through the food bank.
Yeah, it's interesting, right? I mean, think about trying to learn your trigonometry or math or pre-calculus while you're hungry, right?
Yes.
It's hard enough when you have a full stomach,
right.
And trying to learn when you're hungry. It's when you're hungry, that's what you're thinking about. Right. You're so distracted. So having those kids fed when they come in, having those kids fed when they go home is enormous. And sometimes it's the only meals they're getting during the day. I mean, it's unfortunate, but that's super true.
Right.
And so I know the same thing is true with kind of your senior hunger program, right? We've seen some of your commercials for the Golden Groceries and your senior hunger program. Yeah. Maybe you could tell us a little bit about how that works to kind of serve that need on the other end of the spectrum for those seniors.
Yeah. So our Golden Groceries program is a program that is for seniors 60 and over. And it's really a combination of an inventory that's the healthiest food a food bank can bring in. So when we think about beans, we think about beans that are pre-cooked in low sodium juices, right? Or we think about canned fruit that comes in that's not in sweetened juices. So we try to make them as shelf stable as possible so that they will last last longer. But also we provide a bag of fresh bread, we provide produce, things like that, but within the margin of some perishability, because if you're given 15 pounds of perishable food, you can't eat all of that at one time, right? So we have to balance that with what are the things you can eat right away and the things that maybe can last out a week or so. And we provide that Golden Groceries program for about 30 or 35 of our agencies keep a portion of that inventory. And we make that available to all seniors who are really looking for some extra help. And we make sure, too, that it's not just that a senior has to come in for that program, but also that we do home delivery to that
those are
senior.
Delivered right to the doorstep, right? That's the commercial,
right? To the door, yep. And we utilize volunteers to do that, volunteers who want to give back to their community. At the food bank, we have a waiting list of people who want to come in and volunteer for kids programs. And so we're really using commercials like our Golden Groceries program to also highlight the fact that our seniors are kind of the hidden hunger in our community, and that volunteerism for our seniors really gives so much joy to those seniors. And even if you're never walking past the front door of that senior, you may be the only person they see that week. And so that's really a necessary connection for that mental health of that senior who's there. And they really get very attached to the volunteers who come and spend those few moments with them. And so so we provide that home delivery, but we also are always thinking, and we have kind of a decision tree that we use in our call center that screens seniors about whether or not it's better for them to come to a food pantry or it's better for them to get home delivery. And the reason for that is because that connection that is possible at somebody's door is even better, though, when that senior gets to leave their house and go and interact with other seniors or with a pantry who can offer additional services. And so thinking always about the wraparound services, the mental health piece of seniors. I mean, we all day long, we could deliver groceries to seniors and help a lot of seniors. But if we think also about the transportation or other things that we can do to get seniors out of the house and kind of get them interacting in the community, is even better for their mental well-being. And so we have a responsibility to make sure that we're taking into account the whole person and not just the bellies of people who are in need.
You're not a food bank.
Right.
But Three Square, right? You're part of the public health system.
We are.
And I always joke about that because you do so many additional things. So I know your senior hunger program and your breakfast after the bell programs have really impacted tons of people. And I'd love to hear some of the numbers. How many people, how many kids, how many seniors did those programs impact?
Yeah. Through the policy work that we did in 2015 to enact legislation that provided breakfast after the bell to students in our community, we increased the amount of breakfast by an additional 2 million meals over what had been served before. So between 2015 and 2017, we added 2 million extra breakfasts that never had to come through the food bank.
That's crazy. Right? You say that like it's no big deal. We just do this stuff every day. We just
million.
added 2 million meals. No big deal. I mean, that's a huge number of meals. That's incredible.
A huge number,
and
it is to put it in perspective of the size of our community too. In Southern Nevada, we have about 300,000 students who are in our school district. We're the 5th largest school district. And so to add 2 million extra meals for our kiddos in need, that was a significant amount for them. So,
yeah. And then how about Senior Hunger Program? I know, or Golden Groceries, I kind of use those interchangeably. You'll probably yell at me for that. But I know that's kind of where they came from. But tell us about that.
Yeah, so our Golden Groceries Program is serving about 10,000 seniors every month, and about 3,000 or somewhere between 3,000 and 4,000 are home deliveries, and then the rest are seniors who interact with us through our grocery programs and our meal programs. So we do have a congregate meal program that we run for seniors during the week as well.
Right. So somebody says, what'd you do today? Right. We just added 2 million meals for kids. We added 100,000 meals home delivered to seniors. And, I've brought up my aging parents before, and they get some home delivery meals at home, and it is life-changing.
Yeah.
I mean, absolutely life-changing, life-saving for some of these folks that are immobile, unable to get outside. It's 150,000 degrees outside here on certain days of the year to be able to go to the store. That's a really significant piece of work. So I know one of the things that Three Square does really, really well, because I kind of watch from afar. Sometimes I'm over there, obviously, but is that you do evidence-based decision-making, and you really apply, I think, a lot of the things that you've learned here at UNLV, hopefully, to what you're doing there. So tell us a little bit about how your degree helped you do the job that you do and kind of advance the mission and vision of that organization.
Absolutely. When I first started at Three Square in 2009, I didn't come in as the role as vice president, and so I actually came in under research and public policy, and then kind of moved my way up. And in those first couple of years, I was really paying a lot of attention to how do we determine food insecurity numbers in our state? How does the federal government do that? How do local entities do that? And Feeding America was also thinking about that at the same time. And our food bank is kind of under the umbrella with about 200 other food banks under this bigger umbrella of Feeding America. And so Feeding America is kind of like the think tank in a sense for it's a lot of it's the mothership of thinking about food insecurity and the work of food banks. And so they were also giving some time and attention to this. And they realized that the USDA household food insecurity measures are done at the state level. And so when I was a student in public health and thinking about all the data that's tracked really at the federal government level and knowing where I could go for that kind of information. And then I saw what Feeding America was doing and thinking about in terms of assessing food insecurity at the county level. And then I was able to think about, well, what are the demographics of our community? How does that differ from what the federal government is and what some other policy groups are thinking about in terms of data? And I said, I think we could apply this same thread of how you pull data around poverty, unemployment, race and ethnicity, numbers of children in a household, all of these things that really weight in on whether or not populations of people would experience food insecurity, and came up with a way that we could take that same weighted measurements and apply it at the zip code level. And so we went through this big exercise with Feeding America to see if we could actually accurately pinpoint food insecurity at the zip code level. And for us in Southern Nevada, it made a big difference because Clark County, when you think about our county represents 70% of our state's population. Yeah. So whatever happens in Clark County really drives the food insecurity rate for the whole state. And so it's not as big of an impact to our food bank to think that we know what the food insecurity rate is for Clark County because it's basically a mirror of the state rate.
Right.
So how could we use research in a way that helps us direct operations at the food bank? And so not just the intellectual activity of trying to figure out can we accurately pinpoint food insecurity
the application,
with the zip code,
right?
But the application of that, how do we turn that around to drive operational decisions? We now actually look at the food insecurity rate by zip code to help us determine whether or not we have enough agencies in certain zip codes, what the trends of housing and poverty are in certain zip codes. We've taken all of the zip codes of Southern Nevada and we've created regions so that we can really look at whether or not we have enough services and food going into a certain region to close the meal gap. And so that really, I couldn't have done that. And not even be the first food bank in the country to analyze food insecurity at the zip code level without the education that I received here. And biostatistics was my worst class. I was very fortunate to come to a group of people who were better at it than I was, and we formed a study group, and I held on to their hands and got through it. But just really learned so much from that class. It's the class that maybe I struggled with the most, but it's the class I returned to the most. And so that was really helpful to me. And even if I'm not the one who's actually doing the research anymore, I can apply what I learned here to know if it's valid. If we're pulling it from the right sources, if we're looking at it in the right way, if we're using questions that are already pre-validated, right?
Yeah.
So,
Well, there's a rhyme and a reason, right, for all those classes.
Absolutely.
And so everyone seems to have their arch nemesis in there, the course that they didn't think they needed to take. And then later on you go, yeah, I really did need that one.
Oh, yeah.
So, well, I know Three Square has been a tremendous partner, not only for us, but for lots of folks around the community. Maybe one last question for you about students, right? What advice would you give to a student that's kicking the tires, thinking about maybe I want to do something in food insecurity? How do they get involved? How do they get engaged? What can they do? And, looking back, what would you tell them?
Yeah. I do think when we started, the conversation, we talked about like what motivates us and what feels natural to us, right? And so I would just say really hone into that base that you feel like where is my passion lie? And it might, public health is so broad that, it could be that you're really into the data stuff and how demographics look or how things change over time, or maybe it's a certain population of people that really has where your passion lies. And so I would say all of those things have a lot to do with public health, but thinking about how you can get better at the things or even reorganize your own thoughts into ways that is a part of the public health approach, you'll learn so much from that. But if you have that kind of space of I'm coming to it from this perspective, I want to be better at it for this reason, or this is where I, want to be able to go in the future. I think that's really helpful. And then the other thing that I would say, and no matter what you're planning to study as an undergrad or a graduate student, but especially around public health, I would say the best way to get involved or even to find that area of public health that you feel really passionate about is to volunteer.
Absolutely. And you have so many opportunities up there, and every one of those programs we've talked about today has volunteer opportunities. I've been there. There's a world-class volunteer department that can help you do that. So we'd love to see our students, up there contributing and giving back to our community.
We have a lot of internships too, and so some dedicated volunteer opportunities to get more involved in the decision making and things that happen, why certain decisions are made, or how to interact more with people in our community that need these services. And so whether you're coming for what we call a one and done, an opportunity to come and volunteer for 3 hours and feel good about that, or an opportunity to really dive in and be with us for 3 weeks or 3 months or 3 semesters, we really look forward to for those opportunities.
Well, thank you so much for coming on the show today and for all the impact you've had on our community. It's pretty incredible what you and Three Square have done. I mean, literally millions of people impacted, right? And so I want to close with one of the cool quotes that we have on our wall in the School of Public Health, if you walk through there, right? One of my favorite philosophers of all time is Dr. Seuss, right? And so it says, unless someone like you, who cares a whole awful lot, nothing is going to get better, it's not, right? And I think that's so appropriate here. So thank you for coming today. Thank you for being out there and changing the world. If you want to learn more about the School of Public Health or some of these awesome alums or community partners, you can visit us on our social media sites, or you can go to www.unlv.edu/public health. Thank you, Jodi, for joining us today, and thank you for all you do.
Thank you so much for having me. This was so much fun.